Parkinson's disease is the second most common neurodegenerative condition in the United States. It affects 500,000 people in the United States now, and over the next generation, the number of people who have Parkinson's disease will double. And that doubling is going to occur not only in the United States, but it's going to occur globally. The challenge is that many of these individuals with Parkinson's disease do not have access to specialists who can care for their disease. And the question to us is, can individuals with Parkinson's disease receive specialty care wherever they live? And we think the answer to that question is yes. Currently, an individual with Parkinson's disease who resides in Utica, New York, if they want to come see one of the 10 movement disorder specialists here at the University of Rochester, they need to travel 130 miles to us to to see us in clinic, come to clinic, get seen for a half an hour, and then take another 130-mile sojourn back to Utica. This has to occur in all different types of weather, and individuals who are doing it are typically not young, healthy, robust individuals like ourselves, but are individuals who are in their 70s or in 80s, who may have difficulty driving as it is, who by the nature of their disease have difficulty walking and ambulating and have balance problems. We were approached by Mr. Tony Joseph, the administrator for the Presbyterian Home for Central New York in New Hartford, New York, who came to us and says, I have 250 residents in my nursing home in New Hartford, and of these 250 people, about 20% have Parkinson's disease or some related condition. And in our setting, in our environment, we have no movement disorder specialists. The closest one is Syracuse, an hour away. There's one. In our community, we have a neurologist, one. Is there a way that we can provide, that we, the University of Rochester, can provide care to their nursing home residents who often aren't even ambulatory to help improve their care and their quality of life?
The telemedicine visit really is no different than the visit between a patient and physician in the outpatient office. The major difference obviously being we're in two very different locations while we're performing it. We just talk to the patient, ask them how they're doing, ask them specific questions about their Parkinson's disease, complications of therapy. And Parkinson's disease management is a very visual area. So most of the examination is geared towards observing the patient, observing them doing a variety of voluntary motor acts, watching them walk, watching their response to balance tests. And most of that can be done visually, which lends itself very well to the telemedicine encounter. We just do our normal examination, observe what we see, and make recommendations about care. Develop this collaborative relationship with the Presbyterian Home for Central New York and the administrator there, Tony Joseph, to really try to figure out is telemedicine a feasible means of providing care to patients with Parkinson's disease. And we were specifically interested in whether or not we could provide care to patients residing in nursing homes. So Dr. Ray Dorsey and myself designed a small pilot study which primary goal was to see, is this a feasible means for providing care, and what are the participants' and patients' reaction to receiving care via telemedicine. Most of these individuals are older. We might suppose that they might feel a little bit nervous about the technology involved or not comfortable with it and more used to the normal physician-patient interaction. We found that it was very feasible to provide care. All the individuals participating received their visits via telemedicine. There was some suggestion that they actually had improvements not only in their quality of life, they had better satisfaction with care than the individuals who didn't receive telemedicine care. They actually had improvements in their motor function as well. The potential impact of this type of program is huge. There are 500,000 individuals in the United States with Parkinson's disease. Most of them do not live close to an academic medical center or have access to Parkinson's disease specialty care. This would really allow anyone with Parkinson's disease to receive high quality care from a Parkinson's disease specialist regardless of where they live.